Well, greetings again. This is Dr. Bill White with the American Orthodontic Society, and I want to talk some more about the palatal separator. And one of the things that really changed the way we thought about this was the birth of this anterior pressure helps restore the nasal breathing. In other words, putting the pressure up here in the front part of the mouth allowed us to put pressure all the way around the arch, you see, and separate people that we couldn't do it otherwise. It just wouldn't go. And so that's where we started that. And this young man is the one we actually started on. He was, I think, a junior in North Texas State University there, and I was trying to separate his palate, and he just wouldn't go. It just wouldn't go. And he was griping. Of course, when you're separating a palate, when you first start putting pressure, that bothers the person, you know. Now, once the sutures go apart, they feel no discomfort, and it just goes right on then. But until they separate, you're going to have this discomfort from the pressure on there. So he was griping about that. He had been in once before and fussing about it, and I was determined that I would not let this guy go without restoring this nasal breathing. He had such a problem there. And a few months before that, a young man that I kind of chickened out on. It was not quite as bad as this case, but I could not open it, and it didn't open properly, so I gave up on the guy. Well, that guy, I never did get him back to do this, and so I guess he spent the rest of his life with his maxilla all crumpled up in between the maxilla and the mandible, and given problems like that. So I was determined I was going to get this guy across the line if I had to drag him over there some way or another. So anyway, here he is. If I can get back on this deal, get the pen going again. All right. He's truly red-headed, you could say, and a very nice guy. You know, but he was griping, and I don't blame him. I was putting the pressure on him, and it wasn't comfortable, and he couldn't study and read and concentrate on his lesson. So he was complaining about it, and kind of wanted to take him off and not go anymore. And I didn't. I had to finish this case. So anyway, he nice old boy, you know, and he came in. This was back in 1973 when we did this. And back in that day, we had not changed over to the brackets completely, but we later did, you know, about 75, 6, and then we just kind of gradually changed into brackets from bands. Now, at this point, we had him in nothing but bands, and spots in there where there's nothing going at all, but we were anxious to get in here and get this thing going. But I had put the palatal separator up there, and I had cranked it and then putting pressure on it, and it was discomfort to him. And you know, it's got a lateral back in here, and this lateral doesn't have room enough, and these teeth are crowded, and there's a lot of other, and he's got an open bite situation, showing he is mouth breather and a lot of tongue thrust and all that kind of good stuff. So what we're interested in this afternoon is just showing you what can be done with a palatal separator. And if you put a force up here between these two teeth, now if I were still practicing, what I would really like to do is put a screw or something in the bone structure on this side and put a spring, just a total spring over that going out, and have the wire turned in and put pressure on the bone structure. I was putting the pressure on the teeth, and I put this spring we've got in here in. It was one Saturday evening he came in. Well, I tell you, it's 10 o'clock in the morning when he came in, and he was griping about it, and his girlfriend was with him, and this was going on. And so I got him in and looked at it, and I tried to crank it, and I couldn't do it. So I was a little irritated, so I took a piece of wire, and I had already extracted some teeth on the guy, bringing it in. It was real crowded. And so I went back, and both sides we had the extracted teeth on it. And I got this little piece of wire, and here it is. That's Australian wire, and I think that's the old one, 18 thousandths, I'm sorry. And I took this piece of wire like that and just went along into some places here, and we just bent this spring around like this and came off at this angle, and this was coming over here. Now I took that spring and put it between his teeth. I collapsed this laying down here, and this one here, and I put that in the brackets that we had on the teeth, and it was 10 o'clock in the morning when I finished. Got that on, and I turned him loose. It was Saturday morning, and he was in town with his girlfriend, and they went on down into Fort Worth and did some window shopping and stuff like that. And his girlfriend looked at him and said, "Hey, your teeth are apart." And he said he couldn't believe it. He went and looked in the mirror, and he could put a wooden match between his teeth. And the suture had opened with just this added pressure in there. And so that's what we decided, man, on any hard, older case, we put spring between the central teeth up there. Now, you definitely do not want to use this type of spring. So somebody gets it. This is a no-no. You do not use this kind of spring. You put it down there, it'd have your teeth looking like that after, if somebody forgot to come in, it would really mess up like that. So you don't put the teeth there. But here it is. We put the spring in, pull this arm down, and put a leg on it. You would be going here, and we wired that thing on real good, tied it on there good. And this leg, both legs, these legs were out. We brought that down and put it on there. And at about 4 o'clock that afternoon, he came back from Fort Worth, which wasn't too far away, and came in, and his teeth were separated, something like that. And he said he never felt any pain at all when they went apart. So the suture has no nerve endings in it, but if he had not come back then, I think his teeth would have been laying in there like this. So this was a mistake on my part to use this particular spring. So I want to caution anybody that's studying this, do not use that. You put your brackets on here, and you put a wire through here, and you put your spring around in this area that's pushing in this direction, and then that's more or less parallel so that your teeth would just go out apart like that. I mean, it wouldn't be tilted in. So do not use this particular type of spring. And now I think I would go in here and we'd put some tads in here and run the spring right straight across that way. And that we may be able to open people even later than that. But that's the way we did this young man that time. And here he came in. This is 5:93, and this is 4:30 p.m. He came back with his teeth open like that. They'd already started kind of angled a little bit in here. And his girlfriend said, "Hey, your teeth are apart." He was looking in the window, and he went up and looked at us. He said, "I could have stuck a wooden match. You could put a match stem in between those teeth right there." And we'd been trying for several weeks to get this palate separated. Well, we had the case won. Once the sutures went apart, no discomfort. He felt perfectly fine. So I'm going to run through this. I have a video on this already if you want to look it up, or you can just go on what we're doing here today. We saw him in regular time, and this is the way this guy's mouth looked. I mean, it was a mess. I had this bonding on these teeth, and so we're pushing this thing apart back here, though, and not getting the pressure up here. And this is where the thickness of the bone, you know, that anterior nasal spine, the bone coming up here, it was real thick in this area. And so that's where we put the pressure right here. And that thing took those teeth and just widened them out. And I'm going to go through this pretty quick, hopefully, and we'll show you what went on. So there the spring is, but do not use that type. Just come in. I'm cautioning you, and you can bend this down at the end back here and put spring in here. Even though it's turned, it'll still do the separation like that. But do not put that, leave that alone, because somebody's going to go off and leave it for 6 weeks, and their central teeth are going to be in a mess. All right, here we go. There's sewed in like that. All right, he came back in a few days or a few weeks or whatever, and you remember we had that, we banded these lower anteriors, we banded these laterals back behind here, put the spring over here now. We have already separated the suture, so now we can push the teeth back together and we can expand this other, and the palate will stay separated, it will move apart, and we open that every day or two. We'll use a turn on that to open that space up more. So anyway, there it is after he's gone that long, and we're going to start straightening that bottom out. And you can get this video. We have it already made several back a few months or years ago, 2 or 3 years ago. But this was 1973 when we did this. And to my knowledge, I have never seen anybody else put any spring to open the anterior that far back. So I'm just thinking that maybe we were the first people. And in our office there is myself and another assistant I had, and several other assistants in there working and helping us. That this is the first one I ever saw that anybody did like that. I never did publish it. I used it in my lectures, And so we went apart with that, and that's the way it went. And we spread that out, and you can see we just took the teeth in and lined them up, the ones to the left, and then short to the other two. I put some class 2 elastics on. We got a little midline deviation in here, not a serious problem, but anyway, we put our class 2 elastics, pulling this back and pulling these teeth up like that, until we just did the regular orthodontic things that we do. Here on the bottom, we were closing this space right here to tighten these legs together, and so we were bringing this together on the bottom, closing that, and we were doing the closing up here. This spring works pretty good, and I had those type of closing spring. I'll draw that for you. I thought I would. Like you're coming along like that, you drop down, and then you can kind of wrap that around like that. Now if you pull this apart, this will tend to go in, or you push it together, it'll open up space. So you can make closing springs like that if you want to, so they come down, and then you just something like that. They go away. That can be done. And we close that up. You can close that gap with a lot of other things too. So we've got bands on this, and we go through the procedure. And this is 1975 right here. So it's a couple of years into the case, and we're putting elastics like that, keeping this open. In other words, widening this out more. And here, this is a midline, and then this is a class 3 elastic coming in that way. So we go through that, line the teeth all up, pull them together with a lacing, and crank it together. And here it is in 76. And we managed to keep this on this young man, and got this palate separated, and we'll make his retainer. And of course, he's got his, we made the retainer, and we had something on the bottom too. So that's the upper palatal retainer, and on the bottom we pull that together, and I think we put a this should be close to the end of the case now. So with a palatal separator, you took a case that was that difficult, and we pulled that thing in, and he brushed like mad. And this is 1988. He came to me with a big old cavity, and I felt like kicking him. I said, "Man, don't you lose that tooth." So I think he got it filled and got it taken care of. And this is the bottom where we took out the bicuspids in here, and we've got the wisdom teeth. There's one back in here too, on there where we saved the wisdom teeth, taking those teeth out. So here he is, and that's the end of this one. I appreciate you watching, but we have used palatal separators on some difficult cases, and it makes it pretty easy to do the orthodontic work. And this is 1988, and that was 1973 when we started, and to my knowledge, he still has his teeth separated. He didn't collapse back anything in any way at all like that. So I'm going to say goodbye, and I will stop this program right here.